Deidre Burgess, and welcome to Dr. Jones' online class. Today in my audience I have Carol Burgess, Mr. Berry, Kiana, Marissa, and Gus. So my first question for you guys is, are you guys familiar with breast cancer, or do you guys know anything about breast cancer?
I'm not familiar with it, but I know a little bit about it.
Such as?
Such as you can have colon cancer, breast cancer, ovarian cancer, but there's also different signs for cancer that might appear.
Okay. Well, did you know that, tumors itself can be benign or malignant?
Yeah.
Okay. Well, that's my purpose of being here today, is to inform you guys on what breast cancer is and the stages of breast cancer and some things you can do to decrease the development of breast cancer. So you're probably wondering, why am I so adamant about this topic? Well, a couple years ago, I had a situation where I woke up and I felt a little lump in my breast. I thought it was a part of puberty or normal growth. And as months went by, I started feeling like it was getting bigger. So it was a coincidence. I had a doctor's appointment, and I just mentioned it to my doctor, and she felt it. And come to find out, I also had another one on the other side. So she did some tests, and it came back benign. But the whole reason behind me telling that story is because you never know if it's life-threatening or if it's just normal, so it's always best to get it checked. So, of course, like I said, I'm here to inform you not only on the stages, but the development, what breast cancer is in general. So, before I start, my material for my presentation was from breastcancer.org. Alcohol and risk of breastcancer.org, and some other resources which will be at the end of my presentation. So what is breast cancer? Well, breast cancer has been a big risk for women, especially for those who are advanced in age or have chronic diseases. Breast cancer is a damaging tumor that starts in the cell of your breast. The cells begin to grow uncontrollably into groups of cancer cells. There are 4 stages of breast cancer. Along with those 4 stages, things to help prevent cancer would be trying to decrease the amount of alcohol you intake, or having good health as far as your weight, and also breastfeeding. Okay, alright. So the first thing, like I said, I was going to talk about what breast cancer is, which I did, and now I'm going to talk about the stages of breast cancer. So even though there's 4 stages of breast cancer, there is stage 0, which is the beginning, and that one basically is a non-cancerous abnormal cells breaking out of the part of the breast in which they started, or getting through. Well, they don't get through invading or normal cells. So that one is not so cancerous, but it will be pertaining to like my situation where it was benign, so it's not life-threatening. Stage 1 is described as invasive breast cancer, in which the cancer has not spread outside the breast or lymph nodes. Now that stage is broken down into 2. You have 1A and 1B. 1A, like I said, does not spread out of the breast. 1B is there's no tumor in the breast. Instead, small groups of cancer cells larger than 0.2 millimeters, but not larger than 2 millimeters, are found in the lymph. You have stage 2, which is invasive breast cancer. No tumors can be found in the breast, but cancer larger than 2 millimeters is found. Then you have stage 3, which means the breast cancer has extended to beyond intermediate region of the tumor, and may have invaded a nearby lymph node and muscles. Stage 4 describes invasive breast cancer has spread beyond the breast and nearby lymph to other organs of the body, such as lungs, distinct lymph nodes, and skin, bone, liver, or brain. So, were you guys familiar with any of that?
No.
You were?
Yeah, my uncle Petey, he had brain cancer.
Mhm.
He just went through chemo and radiation therapy on his brain, so and he's hanging in there. But they did it too long and stuff, and like it damaged his nervous system and stuff.
Mhm.
So his speech pattern and stuff is real messed up. And his balance and all like
It's
that.
off.
It aged him. I mean, he's 66 years old. Look like it aged him at least 10 more years.
Now, you said he's still going through the
Yeah.
chemo?
He just had his last treatment done.
Well, thanks for sharing that, Samiri. Well, now I'm going to talk to you guys about ways to avoid or decrease the chances of having breast cancer. So, first of all, I'm going to talk about alcohol. Now, I know everyone has experienced, the alcohol consumption, but alcohol can change the way the body metabolizes estrogen. Too much estrogen for the body for females is not good. Women who drink a glass or two a day have 21% increased risk, compared to those who drink more than twice a day face 37% increased risk of breast cancer. And that was according to the Breast Cancer Association. So along with cutting down alcohol, you have obesity, which is, not good for your health. Maintaining a healthy weight would be good too. Being overweight can increase the big risk of breast cancer, which can be stressful at times, of course. Obesity is a condition which a person has an abnormal high and unhealthy portion of body fat. Fat tissues produce excessive amount of estrogen along with other things. With a large amount of insulin in obese individuals can lead up to some development of tumors. And then last but not least, you have breastfeeding. Breastfeeding, well, of course, when women breastfeed, they tend to produce a hormone called prolactin, which lowers the level of estrogen. Women who tend to skip over breastfeeding are against breastfeeding have a better risk of having breast cancer. Studies recommend that, if possible, that you do breastfeed. So, any questions? No? Well, like I said, breast cancer has been a huge misfortune to many women in today's society as they struggle with treatment and losing along the way. They continue to push and strive to live a healthier life. Women should be well aware of multiple stages of breast cancer and start cutting back on alcohol, maintaining good weight,